Thank you all very much. I'm going to make a management decision, which I'm very good at, and we're going to go right through without another break because I'm going to ask Ben and Kamala and Karen and Dina to come up, because what we've done up until now has been to paint a very happy, rosy picture of preaching to the choir on how we believe CCBHCs can have a major impact in our justice system. What we're going to do now is we're going to talk about the nuts and bolts challenges of trying to actually do that within the frame of interoperability and what it would actually take in nuts and bolts world of IT, which is usually a very boring topic, on how we could try to figure out what we've learned about building across the health and justice system and what it is that we can do with that learning in terms of taking us forward into the brave new world of CCBHCs. So with that, Ben, could I ask you to begin your panel?
Certainly. Yeah, I have my mic. Bear with me a second. Okay, my name's Ben Butler. I'm the CIO of Cochs, Community-Oriented Correctional Health Services. The Excellence in Mental Health Act was signed into law by President Obama on April 1st, 2014. 2 days later, on this very stage, I had the pleasure of talking with Linda Rosenberg at another one of our conferences, and I asked her where she thought behavioral health fit into the growing health IT infrastructure. And without missing a beat, she said front and center. And with this panel, our last panel today, we're going to explore just how front and center health IT will be for certified community behavioral health clinics. For the first time, Congress has specified that a specific provider type, CCBHCs, need to have electronic health records and that the data, demographics, diagnoses, and medications need to be stored in a structured format. If one has been paying attention to health IT for the last 5 to 6 years, the requirement for structured data sounds like the basic foundation for interoperability, exchanging health data electronically between diverse providers. One can well understand the needs for interoperability when we glance at these CCBHC partnership requirements. I would especially like to draw attention to the requirements for partnership with juvenile and criminal justice. A large percentage of individuals cycling through our criminal justice system have behavioral health and substance use disorders. But that is not the only reason why I'm emphasizing the requirement of the criminal justice partnership. It is obvious that the technical challenges for CCBHCs are steep. Public safety has long made a connection between behavioral health and people cycling through jails, probably longer than most people sitting here in this audience today. In fact, jurisdictions have developed a way to share data, some jurisdictions, to share data between criminal justice and behavioral health. I like to point these out to people because I've visited these jails. Rochester, New York, that's Monroe County in New York, is exchanging behavioral health information between the jail and their behavioral health systems in that jurisdiction. Pima, Tucson, Arizona. Miami-Dade County, Florida, is working, in fact, on a predictive analytics model for their exchange of behavioral health data. And Salt Lake City, Utah. These are jurisdictions that have all recognized that there's a great impact to their systems by people suffering from behavioral health and substance use disorders. In this last panel, we are going to look at experiences in criminal justice that interface beyond the four walls of the jail. just as CCBHCs with trauma-informed care will need to go beyond the medical four walls. To look at these complexities, let me introduce my first panelist, Dina Passman, who's a lieutenant commander and public health advisor for SAMHSA in their CSAT Health Information Technology team at the Substance Abuse Mental Health Service Administration. Dina, if you want to sit, or you can talk from your chair, whatever you prefer.
Hello.